Hello. Welcome to another episode of the Legislative Lens, spotlighting state laws podcast. And today we're going to be dealing with still staying on Texas. We're going to do Texas 88 legislature. We're dealing with the House Bill number 12. We're going to be expanding Medicaid coverage for postpartum mothers. So let's talk about it. Let's get over. This is a pretty interesting bill. As a host of this podcast, sometimes you read laws that are enacted and you go, should be self-explanatory, right? You would think. But in the state of Texas, postpartum mothers are only covered for 60 days before this law was passed. With this being passed on Medicaid, they're being only covered an additional 60 days after birth on Medicaid. And this law passed, it is now expanding that length of time post delivery of the newborn to 12 months. So, kind of the history of it is that a lot of the states surrounding us, I believe there's 32 in total, actually have a expansion of the Medicaid coverage, and this law kind of gained more traction to become law. This bill did anyway, mainly for a couple things. First things first, the governor of the state did not sign an expansion into law after the COVID-19 pandemic, and as the COVID-19 public health emergency, measures came to a close, Governor Abbott did not make any further declarations or proclamations or executive decisions in the expansion of Medicaid, and he left that to the legislative branch of the government in the state to work on, and it really wasn't coming out as quickly out of the legislature. And really what kind of I guess you could say, put a rocket ship to a law like this was the overturning of Roe versus Wade on the federal side in the federal Supreme Court in the Supreme Court of the United States. So pretty clear is that Medicaid in of itself is designed to help people of the population in the state that are low income, and in the state, Medicaid should be a last resort scenario for those that need it the most. So I can understand completely that those that are in low income will definitely need this coverage. And of course, we always want everyone in society to achieve greatness all throughout their lives. But in this case, with mothers, you don't know the circumstances. We really truly don't. And so it could be a single mother. It could be a victim of an assault in the cases. It could be just a mother that's really on hard times. So with this case and scenario, doesn't have insurance, stuff like that. It wasn't able to work. You never know. So with the Medicaid coverage going from 60 days after pregnancy to a year, it allows the newborn to be treated properly and to get the care that they so need, especially in the early months of their life, with shots and other checkups and things like that are important. So this law really took a whole rocket ship approach once the United States Supreme Court overturned Roe versus Wade, and there was a lot of healthcare spotlight being shown to the state of Texas as well as other states. So this was, I believe, a very self-explanatory situation, but it's a really clear as day bill. But at the same time, you go, really, what took them so long to get to this point? It's really important as well is that this also came at the end of the COVID-19 federal mandates that came down, and states started kind of going through the roles of the Medicaid eligibility programs and moving Texans off the program, and for the first time in 3 years. And there's a lot of things that are going on. So I think it's important to keep this in mind that these laws that were all enacted, um, it showed a rare unity of an issue that has been at the forefront of the American people, which is insurance coverage. In the state of Texas, yes, you do have an option to go through the health insurance marketplace and purchase those, but sometimes those insurances are not affordable. It kind of goes on contrary to the definition of the law, the Affordable Health Care Act. Okay, that's counterintuitive. It is important to note that the role of government isn't to expand into new programs and to do things. It is to help the people that need it the most. And I think um, healthcare coverage in the times in which mothers are very vulnerable in this time, in that time between the first year of a post pregnancy, that they get the health care that they need. I think there's many studies that are out there about postpartum depression and things like that, and I think as well as having that less of a burden on them during the first year post pregnancy can have hopefully improve their life as well as to keep the health of the baby at the highest level, and that's where it really comes down to. Um, this host of this podcast is not a father, is not a is a person that has empathy, that doesn't hold a begrudging look down upon person on these things, but you understand that at the time of when they need it the most, you want the government to help them and do the best they can. And I don't think anyone would rather say that they want to be on government assistance, but there's people in this world that do need it. They're in rough times, and they do. They're not all out there that are needing, um, they're abusing the system. There's not people. Yes, there is people that do that, but in cases like this, I think there needs to be a little bit more oversight. But that's nothing that we haven't heard before. The echoes have been called before. So this law is straightforward. It's an expansion from 60 days postpartum to 12 months, and it was pretty much is passed unanimously in both House and the Senate and the 88th, and it was signed by Governor Greg Abbott. So feel free to join me, continue the conversation in Season 1 Texas. Thank you so much.